40 million U.S. adults take care of a loved one who is elderly or disabled. Now, on top of caring for these loved ones, there's work and there's kids and there's other responsibilities to worry about. May is Mental Health Awareness Month, and it's important to take care for you and your loved one's mental and physical well-being. Today on Who Wants to Know, we're discussing caregiving and senior health. So our experts for today are Greg Brewer, owner and president of Right at Home in the Piedmont Triad area, and Benjamin Ryan, fitness director of Greensboro Workout Anytime. So they're joining us here on Who Wants to Know to answer your questions about staying active, staying healthy, mentally, physically, and about caregiving as well. Here's how you get your question to our experts. You text in that question to 336-379-5775. Remember, this is a text only, so please don't call. All right, so Greg, we're going to start with you to kick things off. And our very first question deals with mental health. What are the signs that my senior loved one might have a mental health condition that should be addressed?
Well, Tanya, the changes could be very gradual and subtle. So if you notice that the senior is doing something different than the ordinary, they're sleeping longer, they're not eating as much, they're feeling or showing signs of being confused more than ever, exhibiting low energy, those types of things. They're eating differently, their eating habits are different, they're experiencing prolonged grief, things like that. So if you notice behaviors that are out of the ordinary, you may want to be concerned about it. And
then you should follow up with a doctor and talk about your concerns and see where you need to go from there.
Absolutely.
Okay.
That's correct.
All right. So Benjamin, let's talk about that. How important physical activity is to a viewer's mental health. What are some of the non-physical benefits of exercising?
It's really important. I mean, I can't stress that enough. You know, it's a huge part of kind of everything we do. Aside, obviously, from the physical benefits, you know, one thing that I can help with is definitely helping to reduce stress. All right, just as a great outlet, healthy outlet. I can even help to regulate our hormones. All right, especially that is part of that stress as well. And, you know, don't discount, you know, just the overall feeling of well-being and, you know, helping us to build confidence as we get stronger, as we are more capable and able to just handle whatever life throws at you during the day is a really huge part of that.
Yeah, and caregiving throws a whole lot at you. All right. So, Greg, let's talk about this. Can mental health disorders be treated, and where do we kind of begin with that?
Yes, they can be, and you want to go to your doctor because the doctors may recommend cognitive behavioral therapy or psychotherapy or other interventions, substance misuse, things like that, that they are trained to observe and to rectify. So you want to make sure that you're talking to maybe even geriatric doctors, because they can prescribe medicines that will help people become much more in order with how they should be, and taking into account the patient's ability to manage their own medications and things like that. You need to have the professionals involved to make sure that things are in order.
Yeah, we all just don't come out of the womb knowing how to handle all of those different kinds of things. So we need some help from the experts. All right, speaking of which, Benjamin, let's talk about this. Let's talk about some physical ways to prioritize our health while staying safe, especially for seniors, because they have some different, you know, things there.
Yeah, absolutely. Well, just to kind of hit again on what Greg said, obviously always check with your doctor if you have any kind of restrictions or concerns before you do exercise. But, you know, continue to just be safe, especially if you are at risk for anything. If you're, wearing a mask, maintain social distancing, if you have any of those risks. But, you know, other than that, one really great thing is to start by exercising with a partner. I think that's something that's really easy and really great. It's always good whether you're bodybuilding in the gym or going on a walk with somebody, have someone there who can, not just encourage each other, but keep an eye on you and make sure you're doing okay with everything. It's hot today, so stay well hydrated. That's something I think we all underestimate and don't do enough of. So definitely do that. And, if you do need some help, obviously, seek out a professional to do that. Come to work at any time, go see, again, your doctor or someone else and do that. But just make sure that you set yourself up from the beginning so that you are safe and you can continue to exercise. I think that we see a lot of people who have short-term goals, try to sort of jump into everything. And, you know, the name of the game really is longevity. How do I stay healthy and keep getting healthier for longer and not just now or next month? So those are really the most important things that I would say.
Yeah, just starting to walk around the house is, one thing. You don't have to be running right down the block. You just need to walk around the house, right? So when we come back,
Absolutely.
we're going to tackle what do you do if your senior loved one resists you bringing in help or you going to get help. We're also going to have Benjamin give us a few exercises, like show us some exercises that can be done for our senior loved ones. That's coming up right after the break.